Hi, I just got a call from a young MDS graduate who, after finishing his MDS, got a few new consultations. But after some time, those clinics stopped calling him for newer cases. He was confused what the problem is. So, in today's video, I'm going to give 5 tips related to it. So, if you are a clinic owner, please share this video with your consultants so they realize what you expect from them. And if you're a consultant, watch this video because you will understand how to behave and what are the points to consider while doing consultations. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Tip number 1, be on time. What happens in the start of a career is you tend to overestimate your speed and you tend to underestimate the time you would take from reaching from point A to point B, because of which you are always in a hurry from reaching one clinic and other. Once you reach the clinic, since you are late, you're already stressed. The patient is anxious and you are forced to do the procedure quickly, as a result of which you might not be able to give in your 100%. Other than this, the dental clinic owner also faces his sets of problems. First is he has to keep the dental chair available for you, so he has to postpone the rest of his cases. Second, the patient is anxious and might keep on questioning the dental clinic owner regarding where you are, how much time you would take to come. So that increases the stressful atmosphere. So dental clinic owners do not like consultants who are always running late. Now, how do you overcome this? Is by having a buffer time. Buffer time means if you think you're going to take 1 hour for the procedure, after that you're going to take around 20 minutes to move from one clinic to another. You keep an extra or additional 15 minutes in between. Yes, you might finish the procedure quickly. Yes, you might not get traffic during your travel and you might reach the next clinic early. But that is okay. You can use that buffer time for other activities. For example, there might be emails which you will have to check. There'll be calls you will have to call back. Finish those. But always make it a habit of having a buffer time between your cases. Because when you're rushed, everyone from the patient, the in-house doctor, and you are in a stressful situation. Tip number 2, be kind and friendly to everyone, not just the doctor and the patient. I've seen a few consultants who barge into clinics and they behave as if the clinic is owned. That is okay, but you need to know how to behave with the assistants, the receptionists, and the other people out there. You cannot be rude with them. For example, you're doing a procedure and the assistant might be confused or would forget something. You cannot yell at them at that point of time. The reason being, the assistant becomes stressed, the patient increases his BP, and the entire atmosphere changes. You have to have a calm and relaxed composure. Even when the situation is not going as per your requirement, remember you are a professional. You have to keep it cool. You have to seem friendly with all the receptionists and staff in the clinics you attend. Because no one wants someone who comes into the clinic and changes the vibe to a negative one. So be a friendly, nice professional. Tip number 3, do not be extreme inquisitive. Now this is exactly opposite from the tip number 2 I told you. Some are overtly friendly and because of their curious nature, they want to know everything what is going on in the clinic. For example, how much do you charge for procedures? What type of patients do you get? How many patients do you get per day or week? How is the dentist out here? How are the other associates dentists? If you have all these questions, keep them to yourself. The reason being, dental clinic owners do not like extremely nosy and inquisitive individuals. If you're curious, eventually, when you're more friendly and you have a better relationship with the in-house dentist, you can ask them these questions. But intruding into their private space, which they might not want to share, is not a good idea. So keep your curiosity to yourself, and when the time permits or once you get friendly, only then ask those questions. Otherwise, learn to behave like a professional out there. Tip number 4, be clear about your ability to the doctor and the patient. Do not tend to overestimate what the treatment outcome is. Because if you promise something more and you are not able to deliver, the patient is unhappy, and that rubs off into the in-house dentist. You do not want to come across as overconfident when presenting your cases. Do not try herodontics. What is herodontics? These are procedures which have a 1 in 1,000 or 1 in 10,000 chances of success. Maybe during your college days, you tried them to evaluate the prognosis of those cases. But in a private practice, you have to give outcomes which are achievable. So do not overpromise and underdeliver. Then the patient and the dentist tend to lose trust in you and would think twice before calling you again. So, should you underpromise? Of course not. If you are not able to show your ability to the dentist, he would think twice even before giving you his first case. So, acting underconfident is also not an option. So, you should be able to communicate clearly what all procedures you can do and what are the best results you can achieve. So, for this, understanding communication is very important. If you're interested in learning communication and you think you lack those skills, we are going to come up with something related to it. So we will have a link in the description below and in the first comment section. You can click on that. It would take you to a WhatsApp page. So soon as we come up with programs related to communication, we will connect with you. So remember, having good communication skills is essential, and if you do not have them, learn them. Before you listen to the point number 5, even if you have got one point out of this video, please do not forget to hit the like button below, because we put a lot of effort to come out with content for you guys. And if you have not subscribed to our channel, what are you waiting for? This channel helps to take your dental career to the next level, so you can keep updated with all the latest videos we come up with. Tip number 5, keep learning. The reason being, the dentist who calls you into his clinic expects you to be an expert on your subject or field. So he thinks you know all the procedures. However, there might be certain procedures you are not confident about, or there are certain procedures you are not completely aware about. But you have to keep learning and upgrading your skills. In the start, you might lose a few clinics if your treatment quality is not up to the mark. You have to take that as a motivation to see that your further treatments are better and always giving better results. Even if you do not provide the latest treatment options, you should know what those are and what are the predictable outcomes from those treatments. And if someone asks you about a procedure or an option which you are not knowledgeable about, do not bluff. Tell them you do not know about it. Go back, read, understand, then contact them and tell him this is what I learned. They need to see the desire to keep improving so that they can keep having faith on you by letting you treat their patients. So if you're a practice owner, which of these 5 points do you think are the most important when hiring a consultant comes? And if you're a consultant, what are the various questions or doubts you have? You can put them down in the comment section below and we'll try answering them. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed.